So just to remind you, Dr. Sebastian Rodriguez Garcia is a consultant rheumatologist at La Princesa University Hospital, and we are going to be talking about his work on Streptococcus pneumoniae in patients with rheumatoid arthritis. So just to start with, I think it would be helpful for our viewers, could you please comment on what is already known on this subject?
Well, thank you, Mrinalini. I'm going to start by telling you that, we know that in patients with rheumatoid arthritis, pneumonia accounts for the highest rate of hospitalization due to infection. And most studies till now regarding vaccination in this kind of patients provides information about the antibody response, that is, the humoral response after administering the vaccine. And it is considered, this humoral response, it's considered as a surrogate for their efficacy. So that it's the capacity of this vaccine to prevent a certain infection. But these two aspects not necessarily correlate. So information regarding the efficacy of these vaccinations in real world settings are needed. So there are only a few studies considering the efficacy of the polysaccharide 23 serotype vaccine, but the results are contradictory. And currently, the CDC recommends a stepwise vaccination scheme using the conjugated vaccine and the polysaccharide as a boost, separated on at least 8 weeks. But so far, there are no studies assessing the efficacy in real world of this stepwise combination protocol. And the recommendation of its use comes from evidence on general population, either general population or HIV-infected patients. So the information about this topic in patients with rheumatic disease is rather scarce.
Okay, thank you. So in light of that, could you give a brief overview of what your study was about?
Well, we included RA participants on the third phase of the Biobalance register to assess the impacts of the combined vaccination scheme on the incidence of infections related to Streptococcus pneumoniae. So we surveyed all participant centers, asking whether they had a systematic protocol for pneumococcal vaccination and whether they were using the stepwise one. We also analyzed the number of events on the outcomes of interest based on the reports to the register using the METRA dictionary. That's the dictionary we use for the codification of adverse events in this register. So when we got this information, we split the exposure of these patients with rheumatoid arthritis into 2 periods: the pre and the post-introduction of this stepwise vaccination protocol. I'm talking about the exposure of these patients to either biological DMARDs or targeted synthetic DMARDs. So we obtained the incidence rates for both periods and observed that there was a clear reduction of these incidence rates after the implementation, the year of implementation of this stepwise protocol, even though most centers were already using a systematic pneumococcal disease protocol, but only with the polysaccharide one. So after that, we obtained the incidence rate ratios comparing both periods. We used Poisson regression modeling, and we adjusted for age, sex, smoking, and Charson index, and obtained an incidence rate ratio of 0.25. Also, after that, we performed several sensitivity analysis. So we test our results in many different scenarios, and the results remain consistent.
Fine, thank you very much. So just looking at the registry data, can you just describe the Biobalance register in a bit more detail for us?
Well, the Biobalance register is a multi-center prospective register that gets information from 28 tertiary centers in Spain, and it has an estimated national coverage of BDMARD and TSDMARD treatment of around 25%. This register was established in 1999, and it was primarily aimed at analyzing the long-term safety of these treatments. But during time, other information was added, such as disease activity and other variables were added to the register to enable investigators to analyze other outcomes besides safety.
Fine, okay. And then just going to the outcomes of your study, you've briefly explained them, but could you just describe in a bit more depth your study outcomes for us?
Well, since we were trying to analyze changes on the incidence of infection related to pneumococcal disease, we have to take into account that sometimes, for instance, in community-acquired pneumonia, it's rather difficult to get isolated, the microorganism isolated, for instance, in blood cultures or using other diagnostic tests such as urine antigen analysis. And we have to keep in mind that some of these infections are the presence of Streptococcus pneumoniae on these infections are rather underdiagnosed. So we define as principal outcomes invasive pneumococcal disease, that is isolating the microorganism in a normally sterile site. That was one of the principal outcomes. And the second one was community-acquired pneumonia. And as a secondary outcome, we also analyzed all codes related to lower respiratory tract infections, because we know that relevant proportion of those infections will be due to Streptococcus pneumoniae, and in some cases, as I was telling you, we don't get the isolation. So we basically analyze events on codes related or relevant codes for these three outcomes.
Okay, thank you. And I guess just to end with, could you tell us what are the implications of this study and your results for clinical practice going forward?
Well, when analyzing the recent EULAR recommendations, there were not enough evidence to recommend either using the old vaccination protocol, using the polysaccharide vaccination, or either using this new stepwise vaccination protocol. I believe that this information that we are providing is quite new, because there are no other effectiveness or efficacy studies on this stepwise vaccination protocol. And based on our results, I believe this study favors the recommendation of using this stepwise vaccination scheme in patients with RA. The results are in favor of it, but certainly we're going to need more information and new studies with maybe with other designs to see if they are consistent with our results.
Okay, thank you very much. Thank you for going through your study with us, Sebastian, and thank you for joining us on EULAR TV. We hope you enjoyed hearing about our work. You can find both Sebastian and my abstracts and presentations now on the eCongress portal. Thank you.
Thank you.